Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So we were discussing about the guidelines for infectious disease control in Ayurveda, and in that series we are specially focusing on Graha Rogas and its management. That means the management principles which are explained in the context of Graha Rogas of Kaumabhritya, how it can be employed as a guideline for infectious disease control as for Ayurveda. So this is a core subject. So we have already completed 2 basic classes, and today we will look into directly into the concepts which is explained in Ayurveda as far as infectious disease control is concerned. Now we will have a glance on the management principles which is explained in Graha Rogas. See, if you list the principles in a tabular form, now what contemporary science says as a part of infectious disease control and what Ayurveda says as a part of Graha Roga management, so they will going to match each other to greater extent. Now see, in the contemporary science usually we will say whenever there is infectious disease is there in the present context, first is identification of the case. That is very important, reservoir identification or case identification. Graha Rogas also says that identify the Graha Rogi first by means of symptoms. Second important principles explained in the contemporary science is isolation of the case, quarantine the case or isolation, and restrict the entry to that particular room where the child has been isolated. And we know that this is to prevent the cross infections, etc. Similarly, in terms of Graha Rogas, the treatment aspect, they say that a Graha Rogi should be isolated from the other Rogis or other normal individuals, and Graha Rogi should be kept in a separate room, and don't allow anybody inside the room except one caretaker. So this is what is explained in Ayurveda, and who that particular caretaker who is allowed to enter inside the room should also follow the strict aseptic measures, and he should not take the madhya, he should not take the mamsa, he should take the bath daily, twice daily, and also he has to wear some of the sugandha dravyas. Now this is very clear, this is extra precaution which is taken to prevent the cross infections. So what is explained in the contemporary science is also explained 5,000 years back in Ayurveda. Another important is a strict aseptic measures. Contemporary science, whenever you talk about infectious disorder, they always give more focus on the aseptic measure, and it should be also. Now similar aseptic measures are also explained in Ayurveda when they say the room should be cleaned twice. The room where the Graha Rogi has been kept, it should be cleaned twice daily and some of the Ushna and Tikshna drug, the powder which is made up of some of the Ushna and Tikshna drugs, should be spreaded on the floor of that particular room, or even some of the basmas should be spread on the floor of the room. Again, these are the extra precautionary methods to taken to prevent the infectious control. Similarly, in the contemporary science, whenever there is the infection, the third most important principle is the symptomatic treatment. We have to treat the affected Rogi. Similarly, in the Graha Rogas also, they says that so many symptomatic treatments should be given: Snana, Grita Prayoga, Parisheka, Lepas, Avagaha, Aushad Dharana, Dhupana, Dhumapana, Agnidanda Homa. So these are the different methods which are explained in the management of Graha Roga as far as Ayurveda is concerned. Modern science also talks about target treatment. That means specific treatment of the disease according to the disease process. Ayurveda also explains a similar type of the treatment. Details we will see in next slides. Then another is, in case of infectious control, as far as the contemporary science, assurance, mental support, counseling, that is also very important. Ayurveda also explains about this assurance and motivational treatment, then mental support, counseling, etc. in the form of Daiva Vapashe Chikitsa, Swasti Vachana, Mangalacharana, Mantra Prayoga, etc. Then prevent the spreading in the society. We know that infectious control, in the last classes we have seen how we have to prevent the control of the organism, or we have to break the chain of infection. So modern people practice many methods, like fogging will be there, and vector control will be there, infectious control will be there, disinfection methods will be there. Similarly, Ayurveda also explains different mass disinfectant methods or community disinfectant methods like Balikarma, Dhupana, Dhumapana, and Homa and Havana. Details again we will see in the coming slides. Now, how this can be interpreted? Now, the patient education, mental stability, and awareness. That is very important, isn't it? First of all, we have to make the patient aware of this particular infection. What is the need of isolation? What is the need of quarantine? How we can prevent this disease? How to break the infectious chain? Okay, so these things has to be made clear to the patient so that he also actively involved in this process. Otherwise, if the patient is remain passive, that is very difficult. Patient should have awareness that how he should try to come out of this problem. So usually we will give such education in the form of counseling, patient awareness, and mental stability or confidence building programs, etc. Similar things are also explained in Ayurveda in the form of mantra chikitsa and Deva, Guru, and Brahmana Shapa, etc. That means it is told that if there is Deva, Guru, and Brahmana Shapa is there, then it is very difficult to get out of this problem. Now, usually these Deva, Guru, Brahmanas in olden days, so they are the source of knowledge, and they are the one who are giving the tips. Okay, so they are the one who are educating the people, and they are giving the tips. So if you are not following their tips, okay, so then definitely you will be in trouble. Therefore, the words like Deva, Guru, Brahmana, Shapa has been mentioned. Another one is mantra chikitsa, that also we will see in detail. Mantra chikitsa is not merely chanting the mantras. Mantra chikitsa is something related to counseling. Now, second important principle is creating awareness of the self and the society. Now, to come out of this problem, so create awareness regarding the self and also regarding the society. Both is very important. So Swasti Vachana and Mangala Charana or Mangala Vachana. So these are again the confidence building programs. Okay, a self-awareness program, motivational program, and confidence developing programs. So Ayurveda do this in the form of Swasti Vachana and Mangala Charana. Then infection control, isolation principles we have seen in the first slide. So Ayurveda talks too much about isolation principles. So it is mentioned that keeping the patient in a separate room, and there we have to nurse the patient. Similarly, infection control by the carrier. So this will be attained by employing the tough rules to the attenders also, because they may be the carriers and they may be the one who is cross-infecting. So therefore, strict rules have been also imposed on the attenders. Now, methods of breaking the infection chain, like personal hygiene or protective measures and contact, etc. Contacts and also precautions against the airborne infections. So this is one of the important things, isn't it? So we want to break the infectious chain to have that, maintaining the personal hygiene, maintaining certain protective measures, and also maintaining the protection against the contacts, and also precautions against the airborne infections. This is quite important. To achieve this, what Ayurveda says, a special procedure called as Aushadhi Dharana Prayoga. Aushadhi Dharana Prayoga means different drugs which are having strong aromatic smell. So they are triturated and made into potali, and it is tied around the different parts of the body. Okay, now these drugs are continuously emitting a strong aromatic smell which will act as a disinfectant or antiseptic or a bacteriostatic in nature, so that it prevents the person from getting infected, and also it nullifies the effect of a cross infection. That means if somebody is having this problem, if come in contact with you, the strong aromatic smell which is coming out from your body, so that will prevent this infection. Okay, so always we know that strong aromatic smell is a very good disinfectant. Now, environmental control, modern science talks about environmental control and fogging, etc. The same process, environmental control and the control of the vectors, etc. So this will be achieved by two important methods which is mentioned in Graha Roga, that is Homa and Havana. So Homa and Havana, where the medicinal drugs are used to, medicinal drugs are burnt in the ghee and other lipid medias, so that this will release their oxides. Okay, so these excerpts are very fatal to these vectors and as well as the infectious organisms. So that's almost similar to that of the fogging which we follow nowadays. So this is nothing but this is one of the method of infectious environmental control. Okay, environmental control. Now, disinfection of the room where actually the patient is kept, that is also important in the hospital setting. Whenever the patient is isolated, we know that. So sterilization methods are followed very strictly and also disinfectants are used. So here in Ayurveda also we have disinfectant methods like dhupana and basma smearing and the lamp which is lit by the mustard oil. So these are some of the methods which are followed actually to maintain the aseptic measures inside the room where actually the patient has been kept. So dhupana not only cleanses, that means not only impart a disinfectant property to the patient and also to the other utensils which are present or other materials which are present inside the room. And smearing the basma all over the body, that is also one of the method, and also smearing the basma on the floor of the room where the patient has been kept, that is also one of the method of disinfection, because all these drugs, they are emitting a very strong aromatic smell, so which act as a repellents for the organisms. Contemporary science also explores contact precaution. So we should not touch directly or indirectly anybody. So close contact, so that may be one of the most common cause for the infection. So similarly, in the Graha Roga context, it is very clearly told that for the airborne infections, dhupana karma is very best. For the skin infections, that means skin to skin contact. So if the disease is spreading through the skin to skin contact, then parisheka, avaga, and lepa and stana. So these are very helpful methods to import the aseptic methods. Okay, now one more is mass disinfection. When the disease is spreading in the community or in the public or in the village or in a particular area, then we have to go for mass disinfection method. So mass disinfection method is commonly practiced nowadays also in the form of fogging and many other things, or chlorinating the water. So these are all the mass disinfection method. So similarly, such methods are followed in Ayurveda in the form of the Bali Chikitsa. So Bali Chikitsa is not simply killing the animal as we think. So it has got scientific understanding, and that we'll discuss in the coming slide. So Bali methods, where an artificial host has been made and all the organisms which are spreading in the society attacking the normal person, so they are attracted towards an artificial host which is easily available and collected. All the organisms are collected there because of the positive chemotaxis or negative chemotaxis method, and then that Bali material has been thrown out of the city so that nobody should come in contact with that. And this is one of the beautiful method of disinfection, mass disinfection or community disinfection, which is explained in Ayurveda science. Similarly, repellents are used for the vectors. Vector repellents are commonly used to control the infectious disorder. Similarly, Ayurveda also explains in the context of Graha Roga the lepa, which is prepared by different aromatic drugs, so that simply act as a repellents. Now, identification of the severity of the infection to take the proper steps. This is another important step that in the present day scenario contemporary science do. First, they identify what is the severity of the disease, mortality of the disease, morbidity of the disease, and accordingly they will take the necessary steps, required steps to control the infection. A similar type of practice is also there in Ayurveda in the Graha Chikitsa, so where they say Agni Danda Homa. Agni Danda Homa is a special type of Homa where the infectious patient will be kept in front of the fire, that is a Homa Kunda, and then the physician will observe the different types of smell and different colored fumes which is coming from the Homa Kunda, and based on that they used to decide the prognosis of the disease. That means severity of the disease will be identified this method. Again, the details we will see in the coming classes. Then we have to look into the reservoir of infection, okay, isn't it? Because from the reservoir itself the infection spread. So Ayurveda also takes care of such things. So they always says that infection is always common in crossing of the four roads. So they says that infection is always common in the crowded areas like temples. Infection is always common. Different types of infections are common in the near the crematorium where hygiene is very less, and it is common in the old distracted home. Nobody is going there. Suddenly, if you are going there, it may be a reservoir of infection. You can carry the infection from there. Or if you are visiting to the unknown places, that is also the reservoir for the infection. And similarly, in the Amavasya and Purnima days, that means no moon and full moon days, where sudden geographical changes will be there. So the environmental humidity may change and you may catch up with some of the infection. So such details are also explained in Ayurveda with respect to infections. So this is just the glimpse of details we will see in the coming classes. So in the next class we will continue the same. Thank you very much.